The 73rd World Health Assembly continues to session through Tuesday, with world leaders convening virtually for the first time due to the COVID-19 pandemic. Hundreds of people took to the streets of Santiago de Chile in the midst of the government-imposed lockdown to denounce the lack of food in the capital city. Morocco has extended its state of emergency and coronavirus lockdown to June 10th. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. The 73rd World Health Assembly began on Monday and will session through Tuesday, with global leaders convening virtually for the first time due to the COVID-19 pandemic. The ambassador of the Bahamas to the UN, Keva Bain, was elected to serve as president of the Assembly.
The 73rd Assembly, during an unprecedented time in history, when the global community is faced with negative health, social, and economic effects of the spread of the coronavirus. And the Assembly convened virtually, bringing together participants from across the globe. The public health community has faced challenges in the past. Global health issues transcend national boundaries and governments, and call for action on the part of the global forces that determine the health of people.
Venezuelan Health Minister Carlos Alvarado reiterated complaints about the unilateral sanctions imposed by the US government, which generate difficulties to access medicines and health supplies to fight the COVID-19 pandemic.
It is necessary to reiterate our complaints about the crime committed against the Venezuelan people through the unilateral coercive measures with which over 30 million euros have been stolen from our people. All Venezuela's bank accounts in the United States and Europe have been frozen, generating difficulties in accessing food and medicines.
And in his address to the Assembly, Mexico's Secretary of Health, Jorge Alcocer, noted the importance of coordinated and comprehensive international efforts to combat the coronavirus pandemic and other health threats around the world.
We are convinced that in this complex moment, we have the opportunity to further guide and coordinate the global response in a comprehensive and coordinated manner, based on scientific evidence, political will, and international solidarity. It has become evident that there is a need to consolidate health systems that are people-centered and guided by the principles of justice and solidarity as the basis for guaranteeing health as a right without distinctions of any kind. This is the foundation for strengthening our preparedness for future health threats.
And Cuba's Minister of Public Health outlined the country's experience in fighting COVID-19, noting that the crisis had become an opportunity for global solidarity. He also stressed that the US blockade has failed to stifle Cuba's international medical collaboration.
This was not prevented by the genocidal blockade imposed by the United States against Cuba, which had been cruelly stepped up, nor the attempts of the government of this country to discredit and hinder medical cooperation from Cuba. President, no country can face this crisis alone. There needs to be a world-level response based on unity, solidarity, and multilateral cooperation. Cuba reiterates to the WHO and its member states its willingness to cooperate and share our modest experience. Thank you.
And the Director General of the World Health Organization defended the agency's response to the novel coronavirus pandemic. He stressed that while the world does not lack the resources to protect itself from pandemics, these need to be used accordingly to ensure that a similar crisis is not repeated.
I'm calling on all nations to resolve that they will do everything it takes to ensure that the 2020 coronavirus pandemic is never repeated. I'm calling on all nations to invest in strengthening and implementing the many tools at our disposal, especially the global treaty that underpins global health security, the international health regulations. To be successful, we must all commit to mutual ownership and accountability.
In Haiti, opposition parties have called for their supporters to resume anti-government demonstrations in the midst of the health emergency sparked by the COVID-19 pandemic. On Monday, the opposition called on the population to resume protests against the administration of President Jovenel Moïse. In response to the call, a small group of protesters took to the streets of the city of Port-au-Prince. They were met with riot police who urged people to comply with basic health prevention measures. The Caribbean nation has so far reported more than 500 COVID-19 cases and 21 fatalities. Hundreds of people took to the streets of Santiago de Chile in the midst of the government-imposed quarantine to denounce a lack of food in the capital city. Chilean President Sebastián Piñera decreed a total lockdown in Santiago on May 15th, but failed to provide programs to ensure economic or food aid to residents who, after 3 days of mandatory isolation, took to the streets to demand the necessary food to survive during the pandemic. The protesters stressed they are not opposed to the quarantine measures, but are suffering from a lack of state assistance. On Sunday evening, President Piñera announced the distribution of 2.5 million food baskets for the poorest families, a move denounced as completely insufficient, given the almost 802,000 people who registered as unemployed between January and March, according to the latest report from the National Statistics Institute. Protests continue in Ecuador against the education budget cuts imposed by the government of Lenin Moreno. While observing protection measures against COVID-19, hundreds of students took to the streets to reiterate their rejection of the government's plan to cut education funds. The demonstrators warned of the consequences of the nearly 10% cut to university allocations in the midst of the health crisis. They also denounced that the measure will result in reductions to teaching and administrative staff, as well as in academic enrollment.
Many universities will not be able to start classes, affecting more than 300,000 college students nationwide. And because we will not be able to start classes, in the Central University alone, cutting $11 million means that no more than 800 teachers can be hired. This basically implies that several programs would have to be closed. It also means that over 900 service employees and workers would be laid off.
Fresh resignations. Several experts in Peru have called into question the credibility of the Medical Specialist Advisory Committee assembled by the Health Ministry to address the COVID-19 outbreak. The latest resignation was the 6th submitted in recent days. The coordinator of the Transplant Intensive Care Unit at the Guillermo Almenara Hospital, Dr. Rosa Lopez, said that her decision was based on a large number of doctors infected with COVID-19 due to a lack of protection and the false figures offered by the government on the number of cases. Peru is the second hardest hit nation in Latin America, with almost 100,000 cases and over 2,000 fatalities, according to official reports. More stories coming up after this very short break, so don't go away. Welcome back to From the South. Venezuelan Vice President for Communications, Jorge Rodriguez, revealed further evidence of the plots against the government of Nicolas Maduro, led by opposition lawmaker Juan Guaidó.
That's the criminal triangle that includes the U.S. administration, that includes the Duque government, that includes Juan Guaidó and his henchmen, and also includes notorious Colombian drug lords and at least one Venezuelan drug trafficker.
The United States continues to lead the world in terms of both the number of COVID-19 cases and deaths reported. The United States accounts for about 4.25% of the world's population, but currently has about 29% of confirmed COVID-19 fatalities worldwide at over 91,000. Models used by the White House suggest the death toll could rise to around 147,000 by early August. The state of New York remains the worst hit in the country, with over 193,000 cases and more than 15,000 deaths. However, there are some signs of hope, with the death rate slowing in New York. Meanwhile, Texas, one of the first states to reopen its economy, recorded its highest new caseload yet. And the rush to reopen states in the US is already having a negative impact, as several states have seen a surge in new COVID-19 cases. Our correspondent Jorge Hestoso brings us the details.
Thank you. The cases of coronavirus are still growing in states that they were reopening their economy in an early stage. That is the case of Alabama, North Dakota, and especially in Texas during Saturday, there were 1,800 cases in just one day. And the national level, we're talking that the cases have already passed 1.5 million and the death over 90,000, and they were expected to reach 100,000 by June 1st. The White House is still trying to blame their slow response to the coronavirus to someone else and went back to blame the CDC, the Centers of Disease Controls, saying that they were very slow in providing them with tests to see who are basically getting the coronavirus. And the CDC response was, don't forget that we are a federal agency and the President of the United States is the one who has already appointed the director of the CDC. In general terms, we're talking that the economy, according to the President of the Federal Reserve, is going to continue to suffer. Jerome Powell has said that only by the end of next year we can see a real recovery of this pandemic. We get back to you now.
According to a study, as many as 6 million people in the United Kingdom fear losing their job within 6 months due to the coronavirus pandemic. The survey also found that 60% of workers are at most 3 months away from rent or mortgage default. The report follows evidence that almost a third of Britain's lowest paid workers have lost their job or been furloughed in the past 2 months, while job losses are starting to rise for those missing out on a limited government support schemes. The inequalities exposed by the COVID-19 crisis also appear to be shaping public opinion, with the study finding widespread public support for giving key workers, including National Health Service staff, care workers, shop workers and delivery drivers, a pay rise. In addition, 69% of those polled supported taxing the rich more to help pay for the crisis. The UK ranks 4th in the world in terms of the number of coronavirus cases confirmed at over 240,000. Russia confirmed almost 9,000 new coronavirus cases on Monday, bringing a total to over 290,000 and representing a possible slowdown in the infection rate. On Sunday, Russia took second place in the world in terms of the number of cases reported, behind the United States. However, its death toll is very low compared to the number of cases, which authorities say is due to widespread testing. According to Prime Minister Mikhail Mishustin, 27 of Russia's 85 regions are ready to start gradually easing coronavirus restrictions.
The situation in the country with the spread of the coronavirus remains quite challenging, although we can see that we have been able to halt the growth of the incidence rate. Of course, the strict lockdown measures played a part, helping us win time and prevent the incidence rate from skyrocketing, as was the case in a number of other countries.
The daily rise in COVID-19 deaths in Spain fell to 59 this Monday, representing the second consecutive day that the figures were below 100. Following the Spanish government's decision to move part of the country to phase 1 of de-escalation of the lockdown last Monday, today sees the rest of the regions doing the same, except for Madrid, Barcelona and some areas of Castile and Leon. Meanwhile, according to a statement by Transport Minister José Luis Ábalos, the country aims to reopen its borders to visitors around the end of June as its coronavirus lockdown fully winds down. Spain is one of the hardest hit nations in the world, having reported over 278,000 cases and over 27,000 deaths. The Italian government has lifted further lockdown restrictions, despite reporting the third highest death toll in the world after the United States and the United Kingdom. On Monday, restaurants, bars and cafes across Italy were reopened as part of Prime Minister Giuseppe Conte's plan to resume most economic activities and lift restrictions on people's movements. Museums, galleries, clothing stores, hairdressers, churches and other religious sites also reopened, but must comply with strict safety protocols and social distancing measures. Travel restrictions have also been lifted, with inter-regional travel resuming, while European travellers will be allowed to enter the country without having to undergo a quarantine beginning in June. And we're taking one final break now, but stay with us for more. Welcome back to From the South. Morocco is set to extend its state of emergency declared in the face of the coronavirus pandemic to June 10th. The country has reported almost 7,000 coronavirus cases, the 4th highest number in Africa.
Since our country has chosen from the outset to give priority to the preservation of the health of its citizens and to put it over all other considerations, and since we have made a lot of progress so far, and in order to preserve this progress, both in terms of epidemic and health, it has been decided to extend the state of health emergency and to extend the lockdown for a period of 3 weeks.
The President of Turkey has announced a national 4-day curfew to contain the spread of COVID-19. Turkish President Recep Tayyip Erdogan announced that the curfew will begin on May 23rd and continue until May 26th as a move to avoid a new surge in cases during the Eid celebrations to mark the end of Ramadan, since Muslims usually visit their friends and families on the occasion. According to the Turkish Ministry of Health, the country has registered over 150,000 coronavirus cases and 4,171 fatalities. Residents in New Delhi have reacted to India's extension of its coronavirus lockdown until the end of May, following the biggest single-day jump in cases in the country. The Indian lockdown, considered the world's largest, affects 1.3 billion people and has been devastating for India's poor, with millions of migrant workers losing their jobs. This is the 4th time the federal government has extended a lockdown, but some restrictions have been lifted. India has reported over 100,000 coronavirus cases.
The situation is such that people have to manage their funds also, so they aren't coming out to buy anything, because what I sell doesn't fall under essential necessities. Right now, people are buying only food because it's uncertain how long this situation will continue. I'm from Uttar Pradesh, and I've been sitting at home for 2 months. I don't have any food left at home, so I had to open my shop today after 2 months. I don't have any food or water, my bank account is empty. I don't have a ration card to my name either, so I decided to open my shop.
The Cuban doctors who arrived in South Africa to help fight COVID-19 have completed their 14-day quarantine in Pretoria. The first group has now arrived in the Northwest Province and is expected to report for duty on Monday. The Cuban Medical Brigade includes experts in the fields of epidemiology, biostatistics and public health. Family doctors will conduct door-to-door surveys and testing and assist local medical workers in health promotion and disease surveillance at the community level. Healthcare technology engineers will also assist in the maintenance, deployment and repair of medical equipment. South Africa is the hardest hit country on the continent, with over 16,000 cases reported, but a much lower death toll of under 300. Meanwhile, over 7,000 patients have recovered from the virus. A team of Chinese medical experts sent to Zimbabwe to support efforts to combat the novel coronavirus held a video conference on Sunday to share their professional experiences with African and Chinese medical personnel deployed across the continent. Representatives of Chinese medical teams in Africa and embassy staff from various African nations consulted with the expert team on the use of masks, patient classification systems, the handling of suspected COVID-19 cases and isolation. The experts also shared their experiences on safeguarding the health and safety of medical personnel and workflow guidelines in fever clinics. The team is made up of experts in infectious diseases and respiratory illnesses, intensive medicine, infection control, traditional Chinese medicine, as well as public health and nursing. Jordanian and Palestinian officials are considering taking simultaneous action, including the suspension of their respective agreements with Israel in response to Israeli plans to annex the occupied territories. Ahmed Deek, director of the Office of the Palestinian Foreign Minister, stated that Jordan and Palestine are working in close coordination on a response to what is considered the theft of Palestinian land. Meanwhile, Najib Kardoumi, a member of the Palestinian National Council, stressed that all options are open, including a suspension of both the Jordan-Israel Peace Treaty of 1984 and the Declaration of Principles signed by the PLO and Israel in 1993. Palestinian President Mahmoud Abbas warned in a recent speech that if any Palestinian land is annexed, there will be no reason to uphold the Oslo Accords and the PLO will be freed from all its commitments to such agreements. Nigerian authorities announced on Sunday that they had impounded a British aircraft for violating coronavirus lockdown restrictions. According to a tweet by Sarika Hadi, Nigeria's Federal Minister of Aviation, UK-based company Flair Aviation was granted approval to fly only for humanitarian operations, but was caught conducting commercial flights. Hadi added that the aircraft crew were interrogated and would face a maximum penalty. Meanwhile, President Muhammadu Buhari met with the COVID-19 Presidential Task Force team on Sunday evening for a weekly briefing and reported that the West African country has confirmed nearly 6,000 cases and a death toll of 182. And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.